Hey Crystal, I need report on patient in 304, please.
All right, this is Kylie. She's a 23-year-old female. She was admitted 5 days ago. We were going to discharge her, but we've seen increasing symptoms of dehydration, lots of urine output. She was in a motor vehicle accident and she suffered a concussion, some head trauma. She had a CT scan of the head and it showed some cerebral edema. Within the last 24 hours, she's put out about 5,000 milliliters of urine.
Whoa.
And we haven't given her any diuretics.
Okay.
We ordered some labs. We're still waiting for the results. And she's stable right now.
Okay. All right. I see she was going to be discharged, but that changed because of these changes with her urine. And how's her level of consciousness? Is she doing all right?
She's alert. She gets a little confused.
Okay. Okay. All right. Thank you very much.
No problem.
Hi, Kylie. I'm Joan. I'm your nurse for the day.
Hi.
Hi. Tell me about how you're doing today.
Oh, I'm okay.
Yeah. Do you know where you are?
I'm at Renown.
Okay. And tell me what date it is.
June 10th.
Okay.
She's been a little confused.
Has she?
Yeah.
Okay.
Okay.
Tell me about what's going on.
I'm so thirsty and they won't give me any water and I have to pee every hour.
Yeah. Well, yeah, that's a lot going on. I know the doctor's thinking about a couple of more tests, but before I get into that with you, I'm going to go ahead and do an assessment, okay? Get some more information to provide him.
All right.
Do you mind sitting up for me? Are you able to do that?
Okay.
Okay. If you don't mind taking off your glasses, I'm just going to do a little neurological check. I heard you were in a motor vehicle accident a
Yeah.
while back.
Yeah, my boyfriend crashed into a tree.
Oh my goodness, yeah. Okay, watch the end of the pen. Okay. I'm going to go ahead and take your blood pressure. Okay. And
Okay.
I'm going to listen to your lungs. Can you take a deep breath for me? Okay. Alrighty. I'm testing for dehydration here. With all that urine you're losing, it seems like you are displaying some signs of dehydration. Your pulse is on the rapid side. Your blood pressure is lower. Your skin's a little bit dry. I'm going to look inside of your mouth. Can you open up for me, please? Yeah, and you've been thirsty quite a bit, haven't you?
Uh-huh.
Yeah. Your mucous membranes look a little bit dry. What the doctor has in store for you is something called a water deprivation test.
Okay.
And it's going to take a couple of hours. They're going to not allow you to drink any fluids. I know that's going to be a little bit hard. Your thirst is quite up there.
I'm really thirsty.
Yeah, but he's going to get a lot of information from this. So it's going to be a test where you're deprived fluids just for a couple of hours, and then they're going to analyze your urine. The doctor's also going to be checking your ADH level. That's the antidiuretic hormone. So he has some suspicions that'll hopefully piece all the puzzle pieces together here and let him know what's going on with you.
Okay.
Okay. Anything else I could help you with before I go right now?
Oh, can I go to the bathroom?
Yeah, come on.
Okay.
If you need some help, I can help you out.
Oh.
Get up slowly. It seems like you're feeling a little dizzy, huh?
Oh, I got really dizzy right there.
that's another symptom of being dehydrated. It's called orthostatic hypotension. So you just, whenever you do get up and use the bathroom, you need to make sure that you get up slowly so that your body can adjust, okay?
All right.
Okay, here we go.
Don't look in my butt. Oh.
Alrighty,
Okay.
here we go. Hi Kylie.
Hi.
So you got the results from that water deprivation test. I heard your doctor was in.
Well, and I don't understand because I don't eat. He said I have diabetes, and I don't eat bad food.
Yeah,
and
she does.
no, I don't. And I exercise.
And first of all, that doctor, he just comes in and like says what she has and leaves, doesn't educate her on anything.
So you have some questions about that. Yeah. Okay. Well, there's two types of diabetes. So the first one has more to do with the food that you eat and your blood sugars. That is called diabetes mellitus, and that is that manifests because of a low use of insulin in your blood.
Yeah, her dad has that.
Yeah. So that's one type, and that's what you do not have. The type of diabetes that the doctor was talking about is diabetes insipidus, and that is because of a low ADH level, antidiuretic hormone that your body is processing, and so that also causes increased urine. Both diabetes cause increased urine, but yours is due to the hormone instead of insulin, the other hormone.
So she doesn't have to take insulin.
No, she does not have to take insulin. Do you want me to explain that to you a little bit more, what your body's
Yeah,
doing with
I'm
that?
really confused.
Okay. Well, with your diabetes insipidus, in normal people, the posterior pituitary release antidiuretic hormone, the ADH, and then that ADH signal is sent to your kidney, and that's what makes you retain your water. In your case, that ADH is not being produced by your posterior pituitary, and your kidneys are just being told that you have too much water, so there's just way too much urine that's being produced in your case. For most people, this can happen with a traumatic brain injury. I understand that you were in a motor vehicle accident a week or two ago, and
Yeah.
that's probably the case with you, is that triggered because of that traumatic brain injury. That communication between the hypothalamus and the posterior pituitary is not normal.
Am I gonna pee like this for the rest of my life?
No, but because the doctor's going to be ordering you some medication. It's called vasopressin, and that is just synthetic ADH hormone. So we'll be able to provide you with what you need so that the body can balance that more regularly.
Oh, okay.
Yeah. All right. Did you have any other questions about the blood results that your doctor went over?
Well, he said that my sodium was really high, and I don't, like I said, I eat really healthy. I don't eat any salt, and so sodium is salt, right?
It is. It is.
You eat Lunchables all the time. How much salt is on Lunchables?
I can explain that too. The sodium level in your blood was probably high. They call that hypernatremia. And that was probably high because your body was just getting rid of a lot of water. So when the water goes from your blood out in urine form, then your sodium level in your blood goes up. So because of that, that's basically a symptom of dehydration. So once we get you on the medication that'll help balance your urination, then that'll level out, and your urinary symptoms will get back to normal too. Okay?
So can I go home soon?
Well, we're going to get you started on that vasopressin, and I'll bring that back and educate you about that in just a bit. And after you get your electrolytes in balance and your urinary symptoms under control, then you should be able to head home.
Okay.
Okay? All right, I'll see you soon.
Thank you. So what do you want to get for lunch when I get out of here?
Hi, Kylie. How are
Hi.
you feeling today? I hear the doctor's going to be discharging you before too long.
Yeah, that's what I heard. I'm really excited.
Well, good. So your symptoms have subsided?
Well, I haven't been peeing as much. They still said it's kind of more than normal, but it's getting better.
Good, good, good. Are you feeling okay when you're getting up to go to the bathroom?
Mm-hmm.
Okay, I see your vital signs have stabilized, so that's good. So they've been giving you that vasopressin, that synthetic antidiuretic hormone, through your IV, and we've talked about now that you're going home that you have that available through the nasal spray. But I just wanted to go over some of the side effects that it could have and things that you need to be on the lookout for, okay?
Okay.
If you have any signs of being disoriented or any behavior changes, then that's something to look out
Kind
for.
of behavior changes. It's crazy.
Yeah.
Other than your normal craziness. If you're starting to feel any chest pain or tremors, that's a sign that you may need your medication adjusted. Um, what's important for you to do is some daily weights, because what we're trying to maintain is a basic fluid, balance in your body. So if you might be gaining weight real rapidly or losing weight real rapidly, if you feel like you're starting to pee quite a bit again and have your thirst increase like you did when you were in the hospital, then make sure you get a hold of your doctor again, okay?
So this could make me gain weight.
Well, that would be weight in the form of fluid retention. Yeah, that might
Oh,
mean that you're
great.
getting a little bit too much of the medication. But that's why it's important for you to just keep track of that, because that can be adjusted if there's something that we need to tweak in your medication, okay?
Okay.
We set up an appointment for you to see the doctor next week, so make sure you follow up on this, because this is probably something that you'll have to take for the rest of your life, okay? But yet we'll just watch that, and you'll need to just follow up with the doctor about that. I have a brochure I'll be providing you with before you leave the hospital.
Okay.
There's more, and on that it has the diabetesinsipidus.org in case you're curious and you want to go to the website and learn a little bit more about this condition. Did you have any other questions at all I can answer for you?
Not that I can think of.
Okay. Well, it was a pleasure taking care of you,
Yeah,
and
thank
good luck
you.
keeping everything in control. I know you can do it.
Okay, thank you.
Alrighty. Bye bye.
Bye.